So thank you for having me. You know, I have been really pleased over the last 21 months that we've been able to make a lot of progress in New Hampshire to expand middle class opportunity, to help innovative businesses create jobs, to keep the economy going in the right direction. And we've been doing it in the what I call the New Hampshire way, really reaching across the aisle, working with each other, and finding a way forward with bipartisan common sense problem solving. Thank you. And we've really provided a platform for what's next. In the last 21 months, we passed the most bipartisan budget in over a decade, balanced without a sales or an income tax. We made sure that we settled 3 very expensive lawsuits that were threatening our state's finances and our bond rating. We invested in workforce preparation and making college and community college and higher education more affordable. We worked together to find a way to have a bipartisan agreement on transportation funding. We worked together, bipartisan support for the Paycheck Fairness Act to support women and their families. We restored funding to Planned Parenthood. We worked together to find a bipartisan way to pass Medicaid expansion. So 50,000 Granite Staters, many of whom didn't have access to health care before, now have the financial and health security that comes with health insurance coverage. And so those are some of the accomplishments that we can now build on. And what I want to keep doing in the next term is focused again on balancing the budget without a sales or an income tax, doing that the New Hampshire way, people coming together, making tough decisions, moving our state forward, making sure that we continue to focus on higher education affordability. That keeps young people here. It also helps us prepare them as a 21st century workforce, which is really important for economic development. And one of the things we need to do, in addition to making sure we have the kind of 21st century workforce we have to continue to provide technical assistance to our businesses. We doubled the research and development tax credit in the last 2 years. I want to work with folks to see how we can improve and strengthen that. We provide technical assistance for international trade, and we boosted up our support for our tourism industry. And we have an initiative called Live Free and Start, which is really focused on how to attract and keep entrepreneurs here, and especially startups here. How do we modernize state government? How do we modernize our regulations to make sure this continues to be a great state for startups? We also need to continue to build on what we've done in healthcare. We need to lower healthcare costs by building on the increased competition in the marketplace that we're beginning to see. We need to lower energy costs, which is a critical issue not only for New Hampshire but for our region. We need to do that, again, in the New Hampshire way, involving the public, finding a diversity of sources of energy, and making sure we protect our natural resources while we do that. If we continue to do that, if we continue to work together to address these challenges, we'll keep the economy moving in the right direction. The last thing that I think we really need to focus on is not only making sure that we're strengthening our businesses and providing economic development, but that we're also strengthening our families. So I'll continue to support for and fight an improvement of our minimum wage, restoring minimum wage and then improving it. It's all about keeping the economy moving forward, and it's all about making sure we do it in the New Hampshire way.
Medicaid, what can your office do, or what can be done to make sure that the expansion of Medicaid and the other provisions of the Affordable Care Act go smoothly?
Well, I'm proud of the fact that when we signed Medicaid expansion last March, enrollment started July 1st, coverage started August 15th, and as of this week we have over 18,000 Granite Staters who are enrolled and have coverage, which speaks to a lot of hard work on behalf of a lot of different people, our state employees, the providers that we work with, the managed care companies that have contracts with the state. There will be bumps in the road, as there always are when you implement a new program with a lot of change, but we are working pretty much daily with our Health and Human Services folks. They're in constant communication with the providers, and right now we are very encouraged that it's going relatively well, and we'll continue to work hard on that. I think one of the goals of the Affordable Care Act and Medicaid expansion generally is to make sure that people have access to primary and preventive care. It's also to try to increase competition in the health insurance marketplace. And one of the reasons we were able to develop, or one of the reasons we did develop the New Hampshire Health Protection Plan, which is a unique plan to New Hampshire, is that by eventually moving the Medicaid, the folks who are covered by expansion into the private health insurance marketplace, we attract more insurance companies to the overall marketplace. So last January we only had one, which was a real challenge and problem for some of our citizens. We expect to have 5 insurers on the marketplace in January, and that's a great improvement. That will provide more choices for all of New Hampshire citizens over time, and it will help lower the costs.
Governor, one of those bumps in the road is going to be, there's have to be, when the government subsidy falls below 100%. And that's going to happen. Is this state, are we prepared for that? What kind of planning has to occur?
Well, what we need to do is continue to work with legislators and the executive branch and our citizens and our providers to determine what the cost will be. You know, as we are covering more and more people, as they are having access to primary and preventive care, as we have coverage for substance abuse and behavioral health for the first time, we believe that that should lower costs generally in other parts of state government. And we, you know, the federal government's 100% subsidy tapers down very gradually, so it's not a sudden change. It will mean that we have to come together and find a way to fund it, and we're going to have to continue to work across the aisle to make sure that that happens.
You had mentioned a little bit already about drugs. Let's talk about drugs. A reporter on this staff over the weekend wrote a powerful and compelling story about a Nashville born and raised a 20-something-year-old teacher who was teaching at Keene High School who recently died from her heroin addiction. It was a secret life that she led. Very sad, powerful story that's generated a lot of response. You yourself have spoken out about this. You've declared it to be an epidemic. Are we doing enough, and what more can we do to tackle this problem? Maybe if you could talk at it from an enforcement standpoint, from a treatment standpoint, and from a funding standpoint at the state level.
Well, certainly the abuse of prescription drugs and heroin is a real public safety and public health challenge for us. And one of the things we really come at it from a variety of angles. From a public safety point of view, we made sure in our bipartisan budget, balanced without a sales or an income tax, to continue funding for drug task force teams, something that was threatened by a reduction in federal funds. From a public health point of view, the Medicaid expansion that we passed provides coverage for substance abuse treatment. Very, very important, because we really haven't had many options for treatment for addiction in the state, partly because we didn't have a funding source to support it outside of private funding. So that's been extremely important, and that will continue to be important, to focus on treatment to help people who are addicted to prescription drugs, hopefully before they turn to heroin, because one of the things that we know happens is people get hooked on prescription drugs and then turn to heroin because it's less expensive. The New England governors have all come together to work on regional approaches, and we're talking both about public health approaches like our prescription drug monitoring program. That's finally up and running. Remember, it was passed in 2012, but then they didn't fund it. So now it's up and running. That helps doctors identify people who have an addiction problem before they write them a script, and we hope will help doctors counsel patients then into treatment. But we want to work with the other New England governors, so if possible, if our laws permit, and if we need to change the laws, we need to work on that. We could share prescription, doctor shopping information across borders. So those are some of the things that we've worked on. We also know that from a public health point of view and a public safety point of view, that there are things we can do to rescue people who are overdosing. So we've worked very hard to train more first responders in the state to use Narcan, and we have a task force operating right now to look at whether additional first responders and perhaps even lay people, which has happened in some other states, can have access to Narcan. That's obviously something you need to do once the person has already used the drug, and I would prefer to be preventing it in the first place, but that's an important part of our response right now.
To your view, though, is this an issue that's resonating strongly enough in Concord so that these things can get done? And this story just doesn't become these kinds of headlines
No,
that we write?
it resonates with Concord. In Concord, it resonates with lawmakers. We have a prevention partnership that's really aimed at going out throughout our education system to talk with young people. We have a curriculum out there to help young people understand the dangers of substance abuse and addiction. And that's another very important component of this, is the educational piece for people to really understand how dangerous using drugs is, and how dangerous even using prescription drugs is. Because I think, well, one of the things we know is that kids seem to believe that if it's a prescription drug, it must be okay, because somebody prescribed it for something. And so we're really working with educators and law enforcement to get that message out too. It is a topic that we hear about from every sector. Substance abuse and behavioral health challenges are things that I hear about from law enforcement on a regular basis, as well as educators. And I think there's a definite collective will in Concord to address it.
I wanted to ask you about the process of setting guidelines for medical marijuana dispensaries to start opening up in the state. Is there a timeline, or when do you expect for those kind of things to be finalized?
Well, I think it's really important that we were able to pass a medical marijuana bill. I believe it's the compassionate and right thing to do. I want providers to be able to prescribe marijuana for those patients with those conditions where it makes sense. It's also important that we do it carefully and that we regulate it well, because we've seen other problems in other states where it hasn't been regulated well, and I want to make sure that we're doing it thoughtfully. So we are working as hard as we can in developing the regs in accordance with the timeline that the bill provided. I know there are people who are anxious for us to complete the process, and there are people who are hoping that they will have the relief of the drug as soon as possible. And we certainly are working to make that happen, but it is important that we do it carefully and well.
Are there any of those regulations that are specifically hope that are enforced or totally thought through by the time that?
I think we're making progress. What we're really looking at is making sure that we have a well-regulated set of dispensaries, and that people understand what the rules are, and that people have reasonable access once they've had the prescription from a doctor. And so we'll continue to do that work, and we'll continue to do it as expeditiously as we can.
You mentioned a few moments ago, I'm backtracking a little bit here, the several times the ways in which the Affordable Care Act has the state on track to reduce costs. Are there things in the act that you feel still need improving? I mean, what would you do to make it even better, or to get rid of some of the downsides?
Well, what I am pleased about is that we've been able to provide increased access to health care for 50,000 Granite Staters. I am pleased that in New Hampshire, the partnership exchange that we have in place, that where people can purchase their health insurance, originally it was slated to cover about 20,000 people. We've seen about 40,000 Granite Staters sign up on the exchange that was provided through the Affordable Care Act. What's most important is that as people have access to preventive and primary care, as they have access to behavioral health and substance abuse treatment, that we work to improve access to care. We work to make sure that we're reimbursing providers effectively, and we make sure to smooth out any problems that do arise. But I was very concerned about the implementation when it first, when the Affordable Care Act first rolled out. But I think we've seen improvements, and right now what we're seeing is a lot of Granite Staters having access to health care through either the exchange or Medicaid expansion, which, as the Business and Industry Association said when they supported Medicaid expansion, you know, if you have a healthy workforce, you have a healthier economy too. And so overall, this is all still about making sure that the economy is moving in the right direction, making sure that people have the kind of health and financial security that they can be full participants in the economy and train up for the kind of 21st century jobs that we know are waiting there.
I don't think we've had a Republican candidate sitting in that seat this season who hasn't assured us that the Affordable Care Act is the worst thing in the world and needs to be repealed. But one point they do make is the potential impact on businesses when the next portion of it hits. Is that an aspect of it that concerns you looking forward?
Well, I'll continue to work with the business community moving forward to make it work as well as it possibly can. But what I think is really important here is that my opponent, for instance, is recommending says that he would repeal expansion altogether. So he would take health care away from 50,000 granite staters. He's proposing a plan that would blow a $90 million hole in the state's budget without telling us what he would cut. We have shown a really good record in the last 21 months, legislators in both parties, citizens from all over the state, healthcare providers from all around, our capacity to come together and solve problems and find a way forward that works for all granite staters. And that's what we're going to continue to build on. What's important here is that having a healthy workforce means we have a healthy economy. It means we're really empowering people to participate in that economy. And as we address whatever problems do arise, and as you know, there are certainly businesses who have talked to me about certain impacts that have seemed uneven to them, we'll continue to work those out together. But that's really what we do in New Hampshire, and it's one of the things that I've been so pleased about in the last 21 months, and it's what I want to continue to work on. 2 years ago, we had a legislature that had really rejected this notion of bipartisanship and common sense problem solving, and now we're back to a place where in New Hampshire we come together and solve problems, and I'm confident we can do that around healthcare too.
You mentioned your opponent's tax plan briefly in there, I think.
Yeah.
Obviously, the Republican Party, which would very much like to see you out of office, is attacking you on a platform of taxes and tax policy. What do you see as the fairest way to support the government?
So what we did in the last 2 years was build a balanced budget that addressed critical priorities. We reinvested in higher education. We reinvested in community-based mental health care. We reinvested in public safety. We put more troopers on the roads, especially in our more rural areas in the state. We reinvested in technical assistance for businesses to make sure that especially we're helping our small businesses compete in the global economy or compete in the tourism economy, particularly competitive in this region. We did that together, and we did it by balancing the budget without an income or sales tax, something I continue to be really committed to because that's the way our economy is structured in New Hampshire. And we'll continue to do that within the current revenue structure.
But New Hampshire has, you do that all based on a patchwork of taxes and revenue sources. At what point do you say, okay, we're losing this source of revenue, how are we going to possibly fill that, or do we need to start cutting back on services? For instance, you get the Medicaid enhancement tax deal is going to drop the amount of revenue that the state has at its disposal. So there's a hole that needs to be addressed. So where do you reach the point where you say, well, we need a new source of revenue, or we need somehow to adjust the sources of revenue so that there's enough to cover what we need to cover?
Well, that's what We do in the budget process every 2 years. We come together and we look at what our priorities are and what our revenues are, and then we find a way forward. We balanced our budget without an income or sales tax. We'll continue to work together to balance a budget. We enjoy one of the lowest overall tax rates in the country, and we'll continue to focus on how to keep our taxes low. I think people value our nimble and small and responsive state government. That's really important, and that's reflected in the way we come together to balance our budget. There are always difficult choices in a budget. Things like the Medicaid enhancement tax settlement, that's one of the lawsuits we settled that otherwise would have cost the state a lot more. We settled 3 expensive lawsuits that threatened our finances and our bond rating. So instead of litigating right now, we're replacing a shamefully outdated women's prison. Instead of litigating right now, we brought the hospitals together to come to that Medicaid enhancement tax settlement, and that's going to help us have a more stable healthcare system. We're expecting that the uncompensated care that revenue addresses is going to go down as the Affordable Care Act provisions and Medicaid expansion kick in. But it would have been much more expensive. The hole would have been much bigger if we hadn't settled it. And so you come together every 2 years and you look at where your revenues are. We have a bipartisan, or actually a nonpartisan revenue estimating panel. They'll come together and help us look at our revenues, and then we continue to innovate in state government. But I'm confident that what we've been able to do in the last 2 years with the budget, balancing it without a sales or an income tax, but still addressing our priorities, is something we continue to be able to do. And it comes by working together, being creative, finding solutions, and making tough choices.
One of the sources of revenue that I think was at one point built into the budget was from expanded gambling, and that didn't work out and caused a certain amount of readjusting of things to address that. Is that something you anticipate trying to build in for the future, and are you rethinking that at all in light of failures of casino gambling in other parts of the country?
What I have set out to do, and what legislators in both political parties have joined me in, is making sure that we're building the foundation for a 21st century innovation economy, a stronger, more innovative state, expanding middle class opportunity, helping these businesses create jobs, keeping the economy going in the right direction, all requires that we invest in certain priorities. We've talked about keeping higher education costs lower. We know we need to modernize STEM education in our elementary schools. We know we need to continue to help small businesses with technical assistance, and we need to attract entrepreneurs here. We know that we have certain challenges that we've talked about, whether it's drug addiction or other public safety challenges. And all of those priorities are things that together will help us build a stronger state. When I look at how we can best fund those priorities so that we can have an economy that is stronger and stronger, one of the things that strikes me as a good source of revenue that is supported by the majority of the people of New Hampshire is one high-end casino. It's supported by a strong majority of people, and it would help us keep revenues that they would otherwise spend in our neighboring states, Maine, Massachusetts soon, Connecticut, and it helps us keep them in New Hampshire to fund those priorities. So I'll continue to make the case for that, because it is a way for us to invest in all the critical things we need to invest in to strengthen our economy, help our middle class families do better and better, and help us all thrive.
So some of the failures of casinos in Atlantic City, some of the warning signs in that world now, are they troubling to you at all, or you think that that's just a different situation there?
I think in every industry that gets increasingly competitive, there are winners and losers.
Mm-hmm.
All the analysis that we see tells us that there is a market for a high-end, highly regulated casino in New Hampshire, and that it would produce substantial revenues that would help us invest in our priorities. And that's what I continue to focus on. I don't understand why we let revenues that are generated by our own people, and they would like to spend in our own state so it could fund our schools, our roads, our bridges, I don't understand why we're comfortable with those going over the border and not keeping them here.
Like one more tax question, and then we'll move on to a different topic. When you were in the Senate, there was an effort to extend the interest and dividends tax to limited liability corporations, and I think you were in favor of that. And it ultimately did not end up becoming law. Is that something that at this point you would favor or not?
Well, in 2009, we were facing, the impact of the worst recession since the Great Depression, and our budget picture was changing very, very rapidly. And we wanted to make sure that all taxpayers were being treated fairly and equally, and that's what that proposal was about. When we discovered that it didn't work the way that people thought it would, we repealed it, and I helped lead the effort to do that. And I think that that was the right thing to do, and I don't think that that's an appropriate thing to do. I stand by the repeal. I think that that's the best thing to do.
On the topic of education, I want to hit on a few points, and I don't want to oversimplify this, but what can we do, or what should we be doing to improve the quality of education in our communities that have inferior resources, of which there are many?
Yeah. First and foremost, we are working with educators around the state to look at what kind of education all of our kids get so that they have choices and we can prepare them for 21st century jobs. That takes a particular focus right now on science, technology, engineering, and math, or STEM skills, taught in collaboration with good communication skills and with the arts, because you want a creative and collaborative workforce as well as one that's technically trained. And so we've got a task force with a diverse group of stakeholders, business leaders, deans of engineering schools, elementary school teachers, and actually teachers from the K through 12 spectrum, to look at how we modernize STEM education and how we can enable local communities to do it in a way that fits for them. I am impressed as I go across the state at the number of schools who don't have a lot of resources but who are finding a way with targeted investments, for instance, in terms of having electronic devices for all their students and really using those as a platform for a creative and effective curriculum that works for every kid. There are a lot of potential solutions here, but certainly we have to keep looking at what we can do to help our schools in the most under-resourced districts, and that's something I continue to be committed to doing.
On the higher education side, Bill wrote an editorial, I think it was last week, that was eye-opening. It had to do with this $800 billion drag that college debt has put on potential home ownership in this country right now, which is kind of startling when you think about it. We have 7 high schools in our coverage area here in the Monadnock region. Is there optimistic news you can share with the juniors and seniors at those schools in terms of things that are going on? We have another freeze, a continuing freeze going on, which I assume means some fees are going to go up. They're facing higher fees in their college education. But is this, what's going to turn this? When is it going to turn? When is it going to get easier for our students to stay here and be able to afford their education?
Well, I continue to focus on college affordability as critical for helping middle-class families expand opportunity and for young people to attract them here to the state, to keep them here in the state, and to keep them here working. I was very pleased that after the devastating cuts of the Bill O'Brien legislature, we were able to restore most of that funding, and as a result, the university system has frozen its tuition. The community college system tuition is reduced 5% this fall over last fall, which is good progress. It certainly is still a challenge for our families and our young people to afford college, which is why we need to continue to focus on it. The university system has continued to be focused on it and is trying to find ways that they could freeze tuition for another 2 years, again, which is good progress. Meanwhile, in our K through 12 system, we're really helping students look at, through a competency-based and career readiness curriculum, understand what it is they want to do and what it is they need to learn to get there, so that there are multiple pathways to successful careers. And we're looking, there are a number of programs within the state where students can earn, up to a year of college credit in their last year of high school, again, taking a year's worth of tuition off the table. Those are the types of creative approaches that we're going to continue to work on. I continue to believe that making higher education more affordable is critical to expanding middle-class opportunity. It's critical to filling the jobs that our innovative companies have right now. I mean, I'm hearing from employers a fair amount that they've got good-paying jobs that they can't fill because they can't find workers with the right skills. And we're going to continue to focus on community college and other kind of higher education opportunities too, so that students have a lot of choices as they go forward and that they don't have to incur too much debt all at once. But it is an ongoing challenge, and it's critical that we address it so we can continue to expand middle class opportunity and keep the economy going in the right direction.